Good evening, everyone. Thanks for joining us this evening. My name is Leslie Fontenot, and I'm the Marketing and Operations Director for Black Health Matters. Rosalind Daniels, founder and CEO, created Black Health Matters in 2012 as a means to provide education around health, wellness, and chronic illnesses impacting our community. Black Health Matters strives to provide these resources that empower you on your journey to better health. In addition to our website, like Facebook Live that we're on today, we also have social channels like Instagram and Twitter, and we host more than 40 community forums focused on health. We have obviously moved these programs to a virtual platform, and we will continue to do so over the next few weeks during Facebook, what we call Facebook Live Wednesdays. So today we're going to talk about childcare in the age of COVID-19. And joining me for this important discussion is Dr. Pamela Huffman-DeVaughn, founder and CEO of the Pediatric and Adolescent Medicine Centers of Philadelphia. She has offices in Germantown, Delaware, and West Philadelphia. So please help me in welcoming Dr. Huffman. And Dr. Huffman will tell our viewers more about her practice and the patient community. Thank you for being here, Dr. Huffman.
Thank you, Leslie, for that nice introduction. And I would like to thank Black Health Matters and founder Rosalind Daniels for inviting me to speak on this most important topic. I am Dr. Pamela Huffman-DeVaughn, President and CEO of the Pediatric and Adolescent Medicine Centers of Philadelphia. We are a group of board-certified pediatricians that serve a wide gamut of pediatric and adolescent medicine services to newborns up until they're 21 years of age. These services include well child visits, sick visits, immunizations, chronic care management like asthma, obesity, and some behavioral issues such as ADHD. Our mission is to provide excellent care so as to close the healthcare disparity gap of children in our community.
Great. So, one thing we're all curious about is how has your medical practice changed or adapted in the past 3 months in light of COVID-19?
Well, the volume has decreased mainly because parents are afraid to come to the office. They're afraid their child may get COVID-19. So we've had to strategize and change our office with safety protocols in place so that parents will feel safe in the office. We also, because we're seeing a lot of newborns, 6-day-olds, 9-day-olds, we did not want to expose them to sick children. So we rearranged our schedules where we would see well visits and immunizations in the morning, and we would handle sick visits by telehealth. And if that child needed to come into the office, we would schedule them near the end of the day. So it's not to have patient-patient contact.
Yeah, that makes so much sense. What precautions are you advising parents to take when they do come in the office? Because obviously they do need to continue to bring their kids in for, immunizations and things like that. What do you tell them to do?
Well, we asked them to call the office first, and there will be screening questions asked. And we can decide if that child is sick, if we can handle it in the office, or if we can handle it by telehealth, if we need to schedule them and bring them into the office. But we also ask that they wear a mask, if that child is over 2 years of age. The parent wears a mask because the staff will be wearing masks, and that's to protect the children as well as the staff. We want the children to come in because we found immunization rates dropping. The CDC has advised us that we need to advise parents to come in to have their child updated on their immunizations. Well, we started this earlier before the CDC recommended it. But if the immunization rates drop, then we will have a reemergence of these vaccine preventable illnesses, such as whooping cough, measles, bacterial meningitis, and leading into the fall, influenza and COVID-19. We do not want that to happen. If that should happen, that would be disastrous to the children as well as the country. So we're encouraging parents to take their child to the doctor to get a well visit, update the immunizations, and any chronic medical illnesses have that attended to.
Yeah, that makes so much sense. You know, early on, there were a lot of misconceptions around whether children could actually get COVID-19. And then recently, we've been reading there's new evidence that some children may become sick and it could be related. What are those symptoms and what's that about?
Well, there has been misinformation, but understand this is a new virus. It's only 5 months old. It was discovered in December 2019. So this virus is evolving. We may find 6 months from now, we will find some other symptoms. But basically, the children do get sick, but the cases are mild. Mm-hmm. So they may just have the common symptoms of fever, cough, and maybe some shortness of breath. If they have shortness of breath, they have to come in or go to the emergency room. But they also have other associated symptoms, and that may be sore throat, headache, vomiting, diarrhea, muscle aches. But what is evolving now recently, we're finding out this new illness that is severe and is thought to be associated with COVID-19. It's similar to a disease, which is a rare disease that I've treated in the past and other pediatricians have treated in the past, and it's called Kawasaki's disease. We don't know what causes Kawasaki's disease, but the CDC seems to think that this new illness is associated with COVID-19, and this illness is called multi-system inflammatory syndrome. Why is it multi-system? Because it affects many systems of the body. And it's inflammatory because it's a severe inflammatory reaction thought to be due to COVID-19. So now this is where you want the parents to listen and watch their child, particularly if they've had a COVID-19 infection, because this is a post-infection syndrome. So some of the things you want to look for fever, more than 4 to 5 days. They may have red eyes, but they don't have discharge, okay, like you might see in quote unquote pink eye. They may have cracked lips, strawberry tongue. They stick the tongue out, it looks like red bumps. We call that strawberry tongue. They may have a red rash. They may have swollen lymph nodes in the neck. They may have swollen hands and feet. So if your child has any or all of these symptoms, you want to call your doctor immediately. If you don't have a doctor, take that child to the emergency room. If we get those children in early, they do very well. Mm-hmm. But unfortunately, because it affects the heart and the blood vessels, these kids may have low blood pressure, go into shock and die. And we have lost some of those kids. And just a point, lately we found that it's affecting Afro-American or Afro-Caribbean kids more than other kids. So I just want the parents to be on the lookout for those signs and symptoms.
Wow, that's pretty intense and very worrisome for parents.
Well, I don't want you to worry because it is a rare illness. Mm-hmm. I'm sure we're going to get more cases later on, but just be on the lookout for those signs and symptoms if your child appears ill.
Sure, that makes so much sense. What are some of the things to consider as cities are reopening that parents should know to keep their children safe?
Okay, well, we look at all of this confusion going on, governors opening up states, some governors still on lockdown. But what I want the parents to use is what my mother would say, just common sense. We know certain measures we have taken has halted or slow down this virus.
Mhm.
Okay. But we have no medications for it. No medications can cure it. We have no vaccines for this virus. So the best we can do is to practice preventive measures. Okay. Make sure your kid is eating well, getting a good night's sleep,
Mhm.
and exercising, staying hydrated. But the main preventive measures you want them to do is to stay home
Mhm.
as much as possible. Avoid crowds and large gatherings. And I know we have Memorial Day coming up.
Right.
2, make sure they wash their hands, and you too, for 20 minutes with soap and water. If you don't have that, then you can use hand sanitizer. And you can teach the kids to wash their hands singing the ABC song. Okay? And at least they'll learn the ABCs, right?
Right. Uh-huh.
Okay. Make sure, regardless of what you hear from government officials or whatever, wear a mask. Okay, the Koreans did that and they really slowed this virus down. Wear a mask. If you wear a mask, that protects me. If I wear a mask, that protects you. So if they go outside, wear a mask. We also want them to practice social distancing. Stand 6 feet away from people. Okay, that helps because this virus is spread by droplets. So if you're close to them and somebody sneezes or coughs, you could get infected. So I would say stay healthy, stay safe, because Black health does matter.
Yes, you're so right, for sure. There was something else that had come up too in terms of, you know, in households where you have multiple children and you have parents, if a parent did actually get COVID-19, what could they do to protect themselves in the same household if it's when it's hard to isolate?
It's hard to isolate, and we're seeing that in the Indian reservation now, especially if you have multiple kids in the family. But the best thing you can do is if that child is infected or if that parent is infected, wear a mask in the house, okay, to protect the other people from being infected. Let them eat out of disposable
Mhm.
plates, cups, utensils, what have you. Make sure you disinfect the area,
Mhm.
and you want to do that anyway if you're not. And if you can allocate that person to a bedroom by themselves or a bathroom by themselves, then that would be great. That's hard to do with a lot of people, but if you have that, try to do that, and that will help.
Yeah, that makes sense. You mentioned the multi-system, I forgot what the name of it.
Inflammatory syndrome.
Is that something that's mainly with children, toddlers, adolescents, or it could be any age group?
Well, it's affecting children of all ages now.
Mhm.
So recently we just had this young lady who's a preteen or teen had it. Now the older kids may not present with all the symptoms like the younger kids,
Okay.
okay? But it can affect, what we're seeing from the reported cases is affecting all the age groups in pediatrics.
Mhm. Okay, well, that certainly is something to look out for. Is there any other information you think that we haven't covered that some people, parents might know or want to know about COVID-19 or just overall childcare in terms of just making sure that they're safe and also thinking about camps and going back to school?
Now that's going to be hard. Okay.
Yeah.
Now we've had a decrease in illness. Why? Because school's out.
Mhm.
Okay. So we actually see increase in illnesses in children when school resumes,
Oh boy.
right? So that's when influenza spreads and that type of thing. So that's going to be a controversial decision. You know, if there's a way that they can set up the schools where these kids won't have so much contact. I just saw in the news this morning where I think Korea, each child has a plexiglass around their desk.
Oh, yeah.
And they have masks and they wear gloves. Well, I think that's neat. We'll see how it works.
Right. We haven't heard anything here. Yeah.
Camp, I would suggest if it was my child, I would probably try an alternative activity for them this summer where they're not in groups. I mean, they can take music lessons or, take dance lessons or something where you're not in a large group. Okay. Unless those camps have ways that they can make people feel safe.
Social distance and all of that. And what about
it's hard to do that with children. And once they get together, they are not going to keep their mask on. And they're not going to wash their hands as often as they should. So that's going to be a challenge.
Yeah. The other thing that comes up, and I know I have nieces, when will it be safe for us to actually, or how can we actually visit with our own nieces or cousins and things like that?
Now you're asking the $1 million questions. That's what everybody wants to know, including me.
Right.
But I think they're doing this testing and trying to test as many people as they can. And once you don't have many new cases occurring, then I think they can make a decision.
Yeah.
So right now, just give them air hugs, talk to them by Zoom or FaceTime, and certainly grandparents. You want to show precautionary measures around them.
Yeah, and someone just asked the question, thanks for your question. What's your opinion on childcare centers reopening and what steps should the childcare centers take? And we talked about that a little bit, but maybe expand on that. Dr. Huffman.
That's a challenge. That's going to be a challenge as well. Depending on how many kids go to that childcare center, it may be just a few. And if they're able to separate them, about 6 feet. I saw some childcare centers, they had a long table. One kid was at one end, one kid was at the other end, and they had masks on it. But if you have a large childcare center, that's going to be difficult. Now, if you just have one person taking care of your child, that's okay, as long as that person does not have COVID-19.
And they wear a mask, right?
Yeah, but if what I would probably do if I had one person taking care of my child, I would have that person checked for COVID-19 before they started taking care of my child.
Okay, makes sense.
And you can get those tests done in a lot of places now. Go to Rite Aid, go to CVS. You don't have to have symptoms. You can, or you can have symptoms, and then they will let you self-swab and give you the test results in about 2 to 3 days.
Yeah, I saw that on TV today. The CVS was offering it over 1,000 locations across the country. That's really great. It's needed.
And Rite Aid, you just drive through and they give you the packet. They tell you how to do it. And then you put the swab back in the packet and give it to them. And then they will call you in about 2 to 3 days. Now, that's what we needed early on.
Right.
Okay. And we were not testing the Black and brown communities, even though we know we had more cases in that particular population than others. Here in Philadelphia, we had the Black Doctors Consortium, and the Black doctors went out and tested people.
Wow, okay.
Okay. So now Rite Aid and CVS are following in their footsteps.
Yeah, sense. Yeah, for sure. So another question that came up is what happens if parents don't bring their children in to get immunized?
Well, then we will have, if it's significant, we will have a reemergence of these vaccine preventable illnesses. And you do not want to see that. I mean, during my residency over 30 years ago, I saw a lot of it. Kids died from bacterial meningitis. I mean, I took care of a 1-month-old who had a myocardial infarction because it got whooping cough from the nanny. Okay. Measles, we don't want an outbreak of measles because you have complications from measles. And so and then going into the fall, you have influenza. So how are you going to tell the difference between influenza and COVID-19?
Right.
Because they have similar symptoms. So that's a disaster waiting to happen. So we just try to encourage them, talk to them on the phone, let them know that we set up safe protocols in the office so they will feel safe for the kid, even if it's nothing but no more than one person in the waiting room.
Mm-hmm.
And if another person comes, like some people will come early for their appointments, some people come later.
Right.
So if another person comes in, we can always have the previous person exit through the back door. So we try to maintain distancing even in the office.
Now, is this something that the American Academy of Doctors or pediatricians recommends overall? Because, people are all across the country. Is this something that most doctors are following anyway with their?
Well, it's recommended.
Okay.
Now, if they're following it, I don't know,
Mm-hmm.
but I can only speak for what we're doing.
Right.
And some of my colleagues.
Okay. So it is probably something that's hopefully universal. So we have another question here. Are child care providers required to take COVID-19 tests?
Well, I'm not sure, but I know that if they should be,
Mm-hmm.
if they're not. But I'm sure whoever employs them will require that.
Mm-hmm.
Like if I sort of had 2 employees, which I knew had underlying medical conditions, and I did not want to expose them to sick children. So I asked them to stay home until this virus slowed down.
Right.
But as they come back, I ask that they have a test. So we know that they're negative before they enter the office. And I also had all my employees tested.
Mm-hmm.
So we can let the parents know so they will feel comfortable in the office.
Yeah, that makes sense. There's another question here. And we talked a little bit about, the fact that you indicated that kids over the age of 2 could wear masks. But if someone has a newborn, how can they protect their newborn when they go in for their doctor's visit if they can't wear a mask?
Please don't put a mask on a newborn. You can protect that newborn if the mother has on a mask or the father has on a mask and the staff have on masks. You've protected that child.
Mm-hmm.
Okay. And we, clean surfaces and wash our hands. So don't put a mask on a kid under 2 years of age because they may have breathing problems. But if the parents have a mask and the staff has a mask, that child is protected.
That makes sense. Okay, and then here's another question that came in. It's if a child catches COVID-19 and then recovers, will they be immune from catching it again or spreading it?
Now, we don't know that, do we? And the research is ongoing. We just heard this morning that Korea was retesting patients.
Right.
And they thought they were positive when really they weren't. So the tests were not accurate.
Mm-hmm.
So when you build up antibodies, that should protect you, but we don't know if this particular virus does that. So we will have research ongoing and we will find that out in the near future.
Right. So we have another question here, and this gets a little bit into the psychology of it, but how should, parents be talking to their children about the pandemic, and how do you talk to children at different age groups, especially teenagers who want to do their own thing and all of that? We have adults that do the same thing, as we know, right?
That's a good question. I think you need to make sure you're calm when you're talking to the kids. And you also want to be hopeful. These kids have a lot of hope. It's the parents that don't have it.
Right.
So you want to be calm and you want to speak to them on their developmental level. What do you know about this new sickness that we have? Okay, to a younger kid. A teenager, you may ask, tell me what you know about COVID-19. And that can start the conversation. Don't assume that they don't know, or don't assume that they do know. But teenagers, you can engage in the conversation. Tell me what you know about it. And if there's any misinformation, you can correct it.
Right.
Okay. And for the little children, you can say, well, what do you know about this new illness? And they can tell you. And if they don't know, then you may talk to them, but don't have a long dissertation when you talk to them. Just get to the point but this is what we can do to fight this virus. We're going to have you wear your mask when you go outside. We're going to have you wash your hands to the ABC song for 20 seconds. Okay. And we're going to try to stay away from some of those other people. So that way we can decrease the spread of this virus. So kind of speak to them on their developmental level. And, but you don't have to go into a lot of details.
Right. Makes sense.
That's your point. But if they come to you for questions, you want to answer them.
Okay. Yeah, definitely. That's some great advice, Dr. Huffman. So we have one other question here. What can mothers do for their children if they live in a shelter, or parents, caregivers, if they're living in a shelter? How can they ensure that they shelter themselves?
Well, I would do the same thing if you were living in an apartment or a home. Just make sure the child washes their hands if they touch, different surfaces. Make sure when they go outside to wear a mask, and try if that child is sick, that's different. Okay, that child has to wear a mask to protect the other. And just try to make sure that child eats well, get enough sleep, and stays hydrated. But if you can use some disposable ware, like plates, cups, utensils, let that child eat out of those.
Yeah, that makes sense. Yeah. So, we're going to wrap up here, but I just want to thank you so much, Dr. Huffman, for this informative talk, and, just very encouraging for our parents and caregivers, and encourage those that are in the Philadelphia or Delaware area to reach out to Dr. Huffman and her staff at the Pediatric and Adolescent Medicine Centers of Philadelphia for care. And also, if you could share with us your website, so that if people want to reach out to you, they can do so and find out more information about the centers. Okay,
it's www.PAMCOP.com. It has my name in it, but it stands for the Pediatric and Adolescent Medicine Centers of Philadelphia.
Well, that works. That works for sure. You're laying on the name of the company. And I also want to encourage you all to continue to follow us on Facebook for our Facebook Live Wednesdays. Next week, May 27th, we'll have the talk on mental health strategies and COVID-19. And I also want to make sure that you register for our 4th Black Health Matters Summit and virtual town hall on July 18th. You'll find more information about that on our website. So you can visit www.blackhealthmatters.com. And I want to encourage you all to be well and stay safe.
Thank you, Leslie. I enjoyed talking with you tonight.
Thanks so much. Bye-bye, everyone.
Bye-bye.